then teeth. All right, so let's start with palate. So there we've got this patient open mouth, and we're going to talk about the palate-glossal arch, the palatal-pharyngeal arch, and where those palatine tonsils are. So there we have, showing in purple, this palatal-glossal arch. It's actually the palatal-glossus muscle that courses from the palate to the tongue, but it's covered with this mucosal lining, so we call it an arch. And then we've got in blue, there's palatal-pharyngeal arch. That's a muscle called the palatal-pharyngeus muscle that goes from the palate to the pharynx, and it's surrounded by mucosis, so we just call it an arch as well. And between the two are the palatine tonsils, between the two arches. And then there's our uvula sitting up the back from the soft palate. So now let's take a look at a medial view of a sagittal section. There's our hard palate, there's our soft palate, and then our palatal-glossus arch courses from the palate, soft palate, to the tongue, hence the name, and then our palatal-pharyngeus courses from the palate to the oral pharynx, and right in between is the palatine tonsils. And so there's our palatine tonsils, and this is what happens when they become enlarged, and they block off a good way for swallowing and for airways. Now the palate sensory innervation. So the palate's innervated by the greater and lesser palatine nerve, which is a branch of V2. So the hard and soft palate and the lingual surface of the gums. So there we've got our cranial nerve V2 going through the foramen rotundum, and then there's our infraorbital nerve going to the maxillary teeth and the skin of the side of the nose and bottom eyelid. And then notice that descending down are these greater and lesser palatine nerves that provide general sensory innervation of the hard and soft palate. There we have another picture showing the same thing. All right, now the muscles, the palatal motor innervation. So the two muscles that act on the palate, there's two. In green is the tensor veli palatini, also known as the eensy weensy teeny weeny tensor veli palatini muscle. And so as its muscle indicates, it tenses the palate when swallowing. It's innervated by cranial nerve V3. Function is tense the palate. I don't care if you remember it from here on out. I'm not going to test you on it. The real clinically relevant one is the levator veli palatini, innervated by cranial nerve 10, and that elevates the palate. So there we've got levator veli palatini, innervated by cranial nerve 10, and when the muscle contracts, it lifts the palate up. Then let's talk about the tongue. So sensory innervation. So the anterior two-thirds of the tongue gets different general sensory and special sensory. And so there are general sensories, cranial nerve V3 via the lingual nerve, and special sensory is cranial nerve 7 via the chordotympany nerve. And so here we've got this schematic. In green, there's our cranial nerve number 5, and V3 is indicated. And then what happens is general sensation from the anterior two-thirds of the tongue, pain, temperature, touch, vibration, is then going to go via sensory neurons and have its ganglion, the cell body in the trigeminal ganglion, goes back to the pons. Now in blue, there is our chordotympany nerve, and so our special sensation for taste via cranial nerve number 7 courses in the chordotympany nerve, hitchhikes on lingual nerve for a while, then jumps on that chordotympany and goes back to the pons. Now the posterior third of the tongue. So there we've got general sensation, cranial nerve 9, special sensation, cranial nerve number 9. And so there we've got our posterior third of the tongue. And so general and special sensation are going to come from the posterior tongue and oral pharynx and go back to cranial nerve number 9, back to the medulla. Now, motor innervation of the tongue. So there's our tongue, and blue represents the epithelium on top for taste and general sensation. That was a yawn that was very rude. Pardon me. And there's our genioglossus muscle. It gets its name because it attaches to genio. Chin goes into the tongue. It's going to move your tongue. And so there we've got the hypoglossal nucleus, where the hypoglossal nerve arises in the medulla, goes through the hypoglossal canal, courses through the submandibular triangle, and shing's going to innervate all those tongue muscles. Now the genioglossus is interesting because look at those two black arrows of showing the vector pull and contraction of genioglossus that picks your tongue right out of its mouth. Finally, teeth. Teeth are comprised of the following there's the following types of teeth. First are molars, comprising teeth 1, 2, 3 on the upper right side, then 14, 15, 16, upper left side, 17, 18, 19, lower left, 30, 31, 32, lower right. And then we've got our premolars, 4, 5, 12, 13, 21, 20, and 28, 29. And then our canines, teeth 6, 11, 22, and 27. And then finally our incisors, 7 through 10, 23 through 26. And there we have our teeth. Now, our molars and premolars are for grinding, and then the canines are for ripping, as are the incisors are food. And so our molars 1, 16, 17, and 32 are known as those wisdom teeth because they're usually the last ones to come in. Now, what about the sensory innervation of our teeth? So maxillary teeth are innervated by cranial nerve V2. So there we have V2, the maxillary nerve that traverses the foramen rotundum, and then as it courses through that infraorbital canal, it gives rise to our posterior superior alveolar nerve, middle superior alveolar nerve, and anterior superior alveolar nerve. And as their name implies, the PSA innervates the posterior teeth in the maxilla, anterior superior innervates the anterior teeth, in the middle somewhere in the middle. Now our mandibular teeth, cranial nerve V3s, traverses the foramen ovale, and then that inferior alveolar nerve courses down through that mandibular foramen by the lingual, enters into that inferior alveolar canal, and provides innervation to the mandibular teeth, exits this mental foramen as the mental nerve.